Welcome to The Hill's Coronavirus Report. I'm Steve Clemons, editor-at-large of The Hill. Each day, we are interviewing those who are part of the global battle against COVID-19. In the United States, we're seeing leaders rise to the challenge. And there are governors, there are mayors, there are regular citizens, there are healthcare workers. Washington, for better or worse, is not the front line of the battle. One of the early national leaders in the coronavirus battle was also one of the earliest infected. Miami Mayor Francis Suarez was the first person to be diagnosed with COVID-19 in Miami-Dade County, Florida, and he immediately self-quarantined. He shared video updates with the public and gave a human face to the virus that many of us didn't have until his example. He's been one of those early on who called for social distancing, closure of schools and big events, and suspension of travel between Miami and other global hotspot countries. Mayor Suarez, thank you so much for joining us today. And first, you look great. I'm very glad to hear that you have recovered from the coronavirus. But let me just ask you to give a snapshot of first how you're doing and how Miami is doing. What's happening in Miami today?
I'm doing very well. Thank you so much for the opportunity to be with you. Miami is doing well as well. We seem to have hit the peak so far with the data that we have on March 31st. Miami-Dade County is lagging a little bit behind us. Their peak seemed to be April 3rd, and Florida's peak is also April 3rd. Now, that is the peak of new cases, new infection cases. In other words, ever since April 3rd or March 31st, it appears that the number of new cases are going down, and that's obviously very good news. The number of deaths, we know, lagged a few weeks behind that number because unfortunately, the cycle of a COVID-19 disease is somewhere between 14 and 21 days. In my particular case, it took me 17 days before I could test negative for the first time, and then the 18th day I tested negative for the second time. So we're seeing deaths still rise while new cases are coming down, and hospitalizations are also favorable in terms of discharges and new patients.
Now, you wrote in the New York Times, Mayor, that you were that nobody really wants to catch something like this, but in a way you were glad you had because it gave you a sensitivity to the dynamics of this virus and what it was going to do not only to individuals but to society. What insights did it give you?
I was actually the second person in all of Miami-Dade County, which is an area with a population of 3 million people, to get it. What that made me feel was, number one, there's probably a lot more people that have it. It's not just a coincidence that the mayor is the second person that has it. The second thing it taught me was that I was asymptomatic. And had I not immediately quarantined, had I not immediately been tested, I could have infected hundreds, if not thousands of people and even crippled our government's ability to function. So I was very fortunate that our fire chief, our medical director took conservative steps to get me to quarantine, to get me to test. And then, of course, I had to run the city virtually for 18 days from home.
Well, I think the other dimension of this is you saw this coming in a way, and you knew it was going to spread. I think when I read some of what you had written and saw other interviews, you saw it coming. What did you do early on to prepare your hospitals, your healthcare workers? You began looking at PPE, personal protective gear, and the other kinds of things we see debated about today about why we didn't stockpile them, and also just seeing this, this kind of law of the jungle struggle between different states for this equipment. Did you move early for the healthcare system in Miami?
We did. Our fire chief identified the threat in February, right around the time that we had the Super Bowl, when the virus was still in Wuhan. So he started purchasing personal protective equipment weeks before anyone else thought of it. We were also consulting with experts at Florida International University that helped us determine that we should cancel 2 large events. One of them was Ultra, which was an event that hosts 150,000 people from 105 different countries. And also Calle Ocho, which is there you go, which is 250,000 people. I was actually criticized when I did that. I was criticized by the county mayor, who said that I acted prematurely, that Miami was open for business, and unfortunately, he didn't close our beaches, which led thousands, if not tens of thousands, of spring breakers to come to Miami to party in Miami. And unfortunately and tragically, we had 2 that passed away after a music festival here in our city. So, we saw the cost of inaction, and we saw the benefits of acting, and unfortunately saw that a lot of cities that acted benefited, and those that didn't act suffered.
Governor DeSantis, as you mentioned, didn't shut down the state. He didn't. He kind of did it in waves. First, South Florida, not the beaches. What kinds of pressures were on him? And was that just a fatal mistake as you see it? Is it something that you think he can get beyond now and has a lot more wisdom about?
I think the first thing was, to his credit, he let the municipalities lead the way. We are the areas with the largest aggregation of population, so he didn't stand in our way from implementing measures early, and so we're thankful for that. He also had to weigh the fact that he had 20 to 25 counties at the beginning that had no cases. So shutting down Florida is very different from shutting down Miami or Tampa or Orlando or Jacksonville. He ultimately ended up shutting down South Florida, and then I think he realized that he was just getting behind all the other governors in the United States that were shutting down their state. And just in an abundance of caution, the right thing to do was to shut down Florida. I'm sure if he had a do-over, maybe he would have done it earlier. But I'm glad that as mayor, I decided early on to be the first city to put a stay-at-home order in Dade County, the first city to put a curfew, the first city, as you said, to cancel large events and to also require those in grocery stores, at banks, and at construction sites to wear masks, and even customers at those establishments to wear masks as well.
Miami is just such a nexus of travel and tourism. The airports, the cruise lines is so much a part of the economy there. How hard was it to write to the president and say, hey, shut down our airport from connecting to these hotspots, and manage the cruise lines the way you were trying to? Because you were trying to basically, grab the flow of so much of Miami's economy and just bring it to a close because it represented such a threat.
Yeah, at the end of the day, my number one obligation is to protect my residents. And listening to the medical experts throughout the country and locally, it became apparent to me that our largest threat, it still is Miami International Airport. Unfortunately, as mayor, I don't have the ability to ground flights or stop flights from coming in. So I wrote a letter to the only person that has that power, which is the president that controls the FAA, and asked him to at least discontinue flights from COVID hotspots, something that American Airlines did voluntarily the following Sunday, and that Puerto Rico did the following week. So this is, this was something, this is an unprecedented time. And I think, unfortunately, as mayor, you have a duty, and that duty is to protect your residents at all costs.
I was talking to my colleague Reed Wilson of The Hill today, and he's got a dynamic model looking at the rise of and the percentage change of cases and deaths around the United States, looking at cities that are past their peak. He said today most of the United States is past this first peak, but there's still places that are still growing, and it's still very sobering. I'd be interested in what your insights are as someone who runs a big city to others around the United States that just are still on the early stages of this, that haven't seen this coming. What would be the 2 or 3 things that you think they need to get their heads around, their hands around as this virus rolls in?
The first thing I would advise them is immediately implement a stay-at-home order, immediately send out advisories on social distancing. I would recommend a curfew as well, because that's even stricter than your stay-at-home order during the daytime. That almost limits to just emergency. People have to leave for emergency reasons. That would be my first piece of advice. The second piece of advice would be, obviously to make sure that you have sufficient beds. If you don't have sufficient beds in your hospital, reach out to the federal government, reach out to your state government, make sure that they're giving you supplementary beds. But it's clear to me, based on the data that we're looking at, that if you do implement these social distancing rules, if you do implement stay-at-home orders, if people do respect those orders, that in about a week to 2 weeks, you're going to see a leveling off of the brand new cases. Obviously, the deaths, like we said before, lag, unfortunately, a week or 2 weeks because of the cycle of infection. But at least in terms of the new cases, there'll be light at the end of the tunnel, and it'll give you reason to believe that better days are ahead.
You may remember in February when we met, it was on the sidelines of the Conference of U.S. Mayors, and you got together with 6 other mayors. You spoke at a forum that I organized, and there was a remarkable degree of camaraderie. It didn't matter if they were Republican or Democrat. We had Jenny Durkin from Seattle. We had the mayor of Kansas City, of Fort Worth, Texas, and of course yourself and others that were there. And I'm just interested in your network of mayors in an organization like the Mayors Conference. Is there frustration, and I would even say anger, with the federal government given what's happened? Because you see real leadership, as I said in my opening comments, real leadership among mayors and governors, but I don't see a lot of applause for what's happening in Washington right now.
Well, I don't know if it's frustration so much as, and I think we talked about this that day on the panel, we always feel like we're going out of the loan. And we understand that if we're waiting for the federal government or if we're contingent on the federal government, then things are going to get ugly real quick. And so the network of mayors, the friendships that we have, the brotherhood and the sisterhood of mayors throughout the country is extremely close. It's probably closer than ever in moments like this. I've spoken to mayors as far as London Breed in San Francisco, Mayor Garcetti in Los Angeles, Mayor Turner, the mayor of Dallas, Eric Johnson, who's my good friend, the mayor of Austin, Steve Adler. I mean, Mayor Barnett, who's the president of the Conference of Mayors. I mean, so many mayors. We're constantly on calls together. Now with Zoom, we can actually see each other. So we're interacting, we're sharing orders, we're trying to help each other make good decisions to protect our residents. So without the mayors, this would be monumentally more difficult.
What should the federal government have done to be more on your side?
I think one thing that we need right now is funding. Obviously, the bailout, what you want to call it, or the stimulus was important. It would have been great if it happened a little earlier in anticipation of April 1st, which was the first day when everything was shut down, when people had to pay their rent and their mortgages. So it would have been great if it would have happened a few weeks earlier. Obviously, getting more testing. That's something that, this is an unprecedented time, and I don't want to, sort of lay blame on anyone, but I think people would have felt more confident had we been able to test sooner. And I think being a little more supportive of our message to stay home would have been helpful.
Tom Bossert, the president's former Homeland Security advisor, has said that to kind of bring the country back online, it doesn't make any sense to test people that are ill or people that are showing symptoms, which is the requirement in many places to get tested today, because those people ought to be quarantined anyway, that you need to test people that are not symptomatic, and that way get a comfort level of getting back, getting parts of the country back online, and as the president wants to bring the economy back. So what are insights you have about the testing problem and actually trying to restart the economy, which is dominating the headlines in Washington right now?
I actually think we need to be testing at all levels. So I think we need asymptomatic testing, and we have to do that probably through some rapid testing technology if it's reliable. And that will give us a macro picture of what we're facing as a city. Is there a bunch of undiagnosed asymptomatic cases, which I think is important to make sure there's not a secondary flare-up. Obviously, right now, I think our city for sure is essentially testing anyone who's symptomatic. I mean, anyone who's symptomatic has an opportunity to be tested. And then there's a third phase. I think anyone who's tested positive, like myself, should be retested after 20 days. And the reason why is there's two reasons. The first is so that they can go back to work and they have a clean bill of health, if you will, that they can take back to their employers and say, look, I had COVID-19, but I'm negative now, I'm safe. And then the second part, which is something that I did, is to donate plasma. I really feel that this experimental new plasma for people who are in a convalescent state is something that could help cure people, could even save lives. And so I would urge people to look for whomever the blood bank is in their community, whether it's One Blood, whether it's American Red Cross, whomever. Talk to your hospitals to decide, to please be able to donate your plasma to potentially help someone who may be in need and may have a much more dire case than you do.
Well, that's in our just last minute, Mayor. Let me ask you about that, because you did donate your plasma. Your plasma was given and shared with, I think, two very sick people. Have others begun to do that in Miami? And I guess my question to you, as you talk to citizens out there, what are the things that regular people could be doing to stand up in this moment, as you've seen in your community? What advice, what counsel would you give them to regular people to kind of step up?
Well, number one, I have had a few people that have donated, but it's just been very difficult because there isn't a lot of back-end testing. So that's one of the things we're going to have to look at. Obviously, we've been focusing a lot on testing people that are symptomatic, but as we come out of this, we have 7,000 people in Dade County that tested positive. Those people should have a right to be retested, and they should be able to donate plasma. And I think that's one way to do it. I think the second thing that we can do is understand that obviously we have to respect social distancing. But
Right.
when we have a situation like this, two things worry me. One is suicide from people who are alone,
Right.
and the second is domestic violence. Our domestic violence complaints are way down, and that actually worries me because I don't think that people are being nicer. I think what's happening is that people feel afraid in this particular predicament where they're stuck at home from calling the police, from calling 911. And so those are the two things that as citizens, I would urge you to try to get involved, either in helping someone, being
Right.
a presence in someone's life, or making sure that if there's any sort of domestic violence happening in your community, to please urge those people to come forward.
Well, we'll leave it there. Mayor Francis Suarez, thank you so much for joining us today. And thank you all for joining me for the Hill's Coronavirus Report. We'll see you tomorrow.